Picture a society where women didn't just assist in healing, they led it, where female hands performed surgeries, diagnosed diseases, and prescribed remedies while standing as equals among the most respected scholars of their time. This wasn't some distant feminist utopia. This was ancient Egypt, over 4,000 years ago. While much of the ancient world confined women to domestic roles, Egypt's female physicians shattered expectations, wielding scalpels and wisdom with the same authority as their male counterparts. Their story isn't just a footnote in history, it's a revelation that rewrites what we thought we knew about gender, power, and medicine in the ancient world. What made Egypt different? How did these women earn such extraordinary respect in a field that would take millennia to fully welcome them elsewhere? The answers lie in crumbling papyrus scrolls and temple carvings that reveal a medical system far ahead of its time. These women weren't mere midwives, they were licensed practitioners who studied anatomy, compounded medicines, and even advised pharaohs. Some rose to become chief physicians of entire regions, their names etched into history alongside their groundbreaking treatments. They navigated a world where science and spirituality intertwined, diagnosing everything from broken bones to mysterious fevers with tools that would seem eerily familiar to modern doctors. But perhaps the most startling part of their legacy is how thoroughly it was erased. For centuries, historians assumed ancient medicine was a man's domain until evidence of these female healers emerged like fragments of a lost manuscript. Today, we're piecing together their remarkable contributions, from surgical techniques still in use to herbal remedies that predate modern pharmacology by thousands of years. Their existence challenges not just our assumptions about the past, but about the very nature of progress. As we walk through the halls of their medical schools and examine the instruments they wielded, you'll begin to see ancient Egypt not as a relic, but as a mirror, one that reflects surprising possibilities about what societies can achieve when talent matters more than tradition. In ancient Egypt, women didn't just occupy space, they shaped it. While Greek and Roman women centuries later would fight for basic recognition, Egyptian women could own land, initiate divorces, and testify in court. This legal autonomy created fertile ground for female physicians to thrive, because in a society where a woman could sue her husband or inherit a vineyard, why couldn't she master the art of setting bones or brewing medicines? Education wasn't just permitted, it was expected. Wealthy families sent daughters to temple schools where they studied mathematics, astronomy, and most importantly, the intricate medical texts that would become their professional foundation. This wasn't token inclusion. The Ebers Papyrus, one of the oldest medical documents ever discovered, shows women actively contributing to its creation. Their handwriting appears alongside men's in notes about treating wounds and diagnosing pregnancy. Some of history's first recorded female doctors emerged from elite circles like Peseshit, who oversaw an entire corps of female physicians during the 4th dynasty. Imagine her inspecting trainees as they practiced stitching wounds on linen pads or debating the merits of honey versus willow bark for infections. These women moved through spaces we'd recognize today as early hospitals, where they examined patients in clean, whitewashed rooms with proper ventilation concepts that wouldn't become standard elsewhere for millennia. What truly set Egypt apart was how seamlessly spiritual and scientific roles intertwined. A priestess diagnosing an illness might check for fever while also interpreting dreams as divine messages. They saw no contradiction between prescribing garlic for parasites and invoking the goddess Sekhmet for protection. This holistic approach gave their work immense cultural weight. When a female physician spoke, she carried the authority of both healer and holy woman. Temple murals show them presiding over births not as assistants, but as lead practitioners directing male aides. Their tools, bone saws, scalpels, and even early forms of forceps were identical to those used by male doctors, proving their equality wasn't symbolic but practical. Yet their greatest legacy might be how casually ordinary their achievements seemed to their contemporaries. A receipt from Thebes lists payment to a female surgeon without fanfare, as unremarkable as paying a carpenter. Legal documents show women physicians testifying as expert witnesses in malpractice cases. This quiet normalization speaks louder than any monument. It reveals a society where talent, not gender, determined who held the scalpel. As we uncover more records in crumbling archives, each scrap of papyrus chips away at modern assumptions, showing us that progress isn't always linear, and that equality had its golden age 4,000 years before our own. Among the dusty corridors of ancient tombs and the fragile pages of medical papyri, we find names that history nearly forgot: women like Merit-Ptah, whose title as chief physician wasn't some ceremonial flourish, but a recognition of genuine expertise. Imagine her standing in the royal court around 2,700 years before our era, diagnosing ailments with the same authority as any male healer. Her existence alone rewrites the narrative, proving that from the very dawn of recorded medicine, women held positions of power in this field. Then there's Peseshit, whose role as overseer of female physicians reveals something even more extraordinary: an entire network of trained women healers operating under her guidance. Tomb carvings show her inspecting rows of apprentices as they ground herbs into pastes or practiced setting fractures on wooden models. These weren't sidelines or informal roles. They were structured, respected professions. A surviving payroll ledger from the Old Kingdom lists payments to Peseshit's team alongside other civil servants, confirming their work was as official as any scribe or architect. What's truly remarkable is how casually these women appear in records, their presence treated as utterly unremarkable. A wall painting in Saqqara depicts a female physician leaning over a patient, her hands steady as she probes a wound while male assistants hand her tools. No one in the scene bats an eye at her leadership. It's simply how medicine was practiced. Even the famed Edwin Smith papyrus, packed with surgical knowledge, includes contributions from female scribes who added their own annotations to treatments for dislocated jaws or spinal injuries. The tools buried with these women tell their own story. Archaeologists have uncovered kits containing bronze scalpels, probes, and even early forms of stitching needles identical to those found in male doctors' tombs. One such set, discovered near Thebes, included a labeled container of opium poppies for pain relief, proving these women weren't just theoretical healers but hands-on practitioners managing complex pharmacology. Their prescriptions, recorded in hieratic script, show astonishing sophistication, from using celery seeds to reduce inflammation to recognizing that honey prevented wound infections millennia before modern science confirmed its antibacterial properties. Perhaps the most telling detail lies in how they were remembered. While Greek physicians like Hippocrates would later be celebrated as lone geniuses, Egyptian inscriptions celebrate teamwork. Peseshit's tomb specifically honors the women who heal under her command. This collective recognition hints at a medical culture that valued collaboration over individual glory, where knowledge was shared freely between genders. As we piece together these fragments, a startling truth emerges. Ancient Egypt didn't just tolerate female physicians, it expected them, trained them, and immortalized their work as a natural part of civilization's progress. Their legacy wasn't written in whispers but in stone and ink, waiting centuries for us to finally listen. The path to becoming a female physician in ancient Egypt wasn't for the faint of heart. Picture a young woman kneeling in the torchlit halls of a temple school, her fingers stained with ink as she copied medical texts word for word. This was where healing began, not with a single brilliant insight, but with years of disciplined study that would put many modern medical programs to shame. Temple schools served as the Ivy Leagues of their day, where women and men alike memorized detailed anatomical charts and mastered the properties of hundreds of herbs. The famed House of Life wasn't just a library, it was a living laboratory where scholars debated diagnoses, tested remedies, and preserved knowledge that would span generations. What set these institutions apart was their remarkable balance of hands-on training and theoretical knowledge. A student might spend mornings dissecting animal organs to understand human anatomy, then afternoons compounding medicines from precise recipes, measuring myrrh by weight, fermenting honey into antibacterial salves, or grinding malachite into eye treatments that modern studies confirm had genuine antimicrobial properties. The Ebers Papyrus reads like a modern medical textbook, with its sections on everything from tumor removals to contraceptive methods, proving these women weren't dabbling in folk remedies but mastering a scientific discipline. Apprenticeships formed the heartbeat of their education. A novice healer would shadow experienced physicians like a surgical resident today, observing how to splint a fractured arm with linen and wooden braces, or when to prescribe garlic for parasitic infections. Some of the most revealing artifacts are the practice models' wooden limbs for setting brakes, ceramic vessels for mixing drugs, that show how seriously hands-on training was taken. A fragment from Deir el-Medina even records a female student's mistake in calculating a dosage, her instructor's corrections scrawled in the margin like a professor's red pen. But their education went deeper than clinical skills. These women learned to navigate medicine's spiritual dimensions, reciting incantations to Sekhmet while also recognizing when a fever required cold compresses rather than prayers. A healer's toolkit included both scalpels and amulets, not because they confused magic with science, but because they understood healing required tending to both body and mind. This duality surfaces in tomb paintings where a physician checks a patient's pulse with one hand while offering a protective charm with the other, a reminder that ancient medicine's power lay in its ability to speak to every facet of human suffering. The true testament to their training's rigor lies in the trust they earned. When a female physician like Merit-Ptah prescribed a treatment for migraines, a blend of coriander, juniper, and frankincense still used in aromatherapy today, her recommendation carried the same weight as any male colleagues. Legal records show women testifying as expert witnesses in court cases about malpractice or inheritance disputes over medical tools. Their signatures appear on prescriptions, their names etched into tomb walls as WNW, the official title for a licensed physician. This wasn't honorary recognition, it was hard-earned professional standing, forged through years of study that left no room for half measures. Perhaps the most striking detail emerges from student exercise tablets, where young healers practiced writing case notes. One fragment describes a woman's symptoms: headaches, nausea followed by the diagnosis of pregnancy. What makes this ordinary note extraordinary is the writer's name, a female student analyzing another woman's body with clinical detachment, centuries before Hippocrates claimed women were too emotional for such work. These fragments collectively reveal a truth that challenges modern assumptions that ancient Egypt's female physicians weren't exceptions to the rule, but proof that the rule itself was far more progressive than we ever imagined. Specialization wasn't just common among Egypt's female physicians, it was essential. Imagine walking through the bustling streets of Thebes, passing clinics where women healers focused on specific branches of medicine with the precision of modern specialists. One might encounter a physician like Tet, whose practice centered entirely on women's health, prescribing contraceptives made from acacia gum, a method later proven to have spermicidal properties, or diagnosing pregnancy by checking for traces of barley and wheat germination in urine, an early form of hormonal testing. Nearby, another healer might specialize in gastrointestinal disorders, compounding remedies from cumin and fenugreek to soothe inflamed intestines, her workspace lined with jars labeled for specific dosages and ailments. The sophistication of this system becomes clear when examining tools buried with these women. A tomb in Saqqara yielded a gynecologist's kit containing a speculum-like device for examinations, while another revealed a surgeon's bronze instruments, scalpels with edges sharp enough to make precise incisions, and hooks for removing nasal polyps. These weren't general-purpose tools, they were tailored to specific procedures, suggesting years of focused practice. Even more telling are the papyrus records that refer to healers by titles like "She Who Deals with Eyes" or "Lady of the Birthing Stool," cementing their reputations as experts in particular fields. Childbirth specialists held especially revered roles. While many ancient cultures viewed delivery as perilous women's work, Egyptian texts describe trained midwives performing maneuvers to turn breech babies, techniques still taught today, and using opium-laced beer for pain management. A fragment from Kahun gynecological papyrus details a female physician's method for stopping postpartum hemorrhages with a paste of crushed tamarisk and honey, demonstrating knowledge that wouldn't be rediscovered in Europe for thousands of years. What's striking is how these specializations intersected with spiritual roles. A woman treating infertility might prescribe a blend of dates and herbs while also leading rituals to Hathor, the goddess of motherhood. This dual approach wasn't contradictory. It reflected an understanding that healing required addressing both physical and emotional needs. Tomb paintings often show these specialists working in teams, a gastroenterologist consulting with a surgeon, or a midwife assisted by a herbalist, proving collaboration was baked into their medical culture. The pinnacle of specialization may have been Peseshit's role as overseer. Much like a modern chief of medicine, she didn't just treat patients, she coordinated teams of specialists, ensuring knowledge flowed between them. A ledger from her temple lists allocations of rare ingredients: myrrh for the pain relief specialist, aloe for the burn treatment team, all carefully measured and tracked. This level of organization suggests something revolutionary: a healthcare system that recognized expertise mattered more than gender, where a woman could rise to lead because her skills demanded it. Perhaps the most poignant evidence lies in the patients they treated. A mummy from the New Kingdom shows a healed mastectomy scar, indicating not just surgical skill but aftercare, likely supervised by a female physician specializing in cancer treatments. Another displays a perfectly set compound fracture, suggesting orthopedic knowledge passed down through generations of women healers. These weren't isolated cases. They were part of a continuum of care stretching across centuries, where each specialist added her discoveries to medicine's collective wisdom. Their legacy defies simple categorization. These women weren't just doctors, they were chemists compounding antibiotics from moldy bread, surgeons wiring jaw fractures with gold thread, researchers documenting how certain herbs lowered fevers. The very existence of such roles reveals a society that saw medicine not as a monolithic craft, but as a constellation of interlocking sciences, each worthy of lifelong study. In a world where we still debate women's places in STEM fields, ancient Egypt's female specialists stand as quiet revolutionaries, their scalpels and prescriptions carving out a truth we're only now rediscovering. Expertise has never had a gender. The tools unearthed from ancient Egyptian tombs tell a story of precision, ingenuity, and gender-blind professionalism. Imagine a female physician's kit laid out on a linen cloth, bronze scalpels gleaming in the sunlight, their edges still sharp enough to slice papyrus thousands of years later. These weren't crude implements but masterfully crafted instruments, some so finely balanced they rival modern surgical tools in design. Archaeologists have found bone saws with teeth spaced for clean cuts, probes for examining wounds, and even spatulas for mixing medicinal pastes, all identical to those buried with male doctors. This parity in equipment wasn't accidental. It reflected a medical system where skill, not gender, dictated who held which tool. What's particularly fascinating are the subtle adaptations in some instruments. A collection from Abusir included slender forceps and tiny scalpels, likely used for intricate procedures like removing cataracts or repairing teeth. These specialized tools suggest female physicians weren't just generalists but pioneers in early forms of microsurgery. One delicate hook, no thicker than a hairpin, might have been used to extract nasal polyps, a procedure requiring steady hands and anatomical knowledge that wouldn't become standard in Europe until the Renaissance. But their toolkit extended beyond metal. Linen bandages, meticulously folded and sterilized with salt, show an understanding of infection control millennia before germ theory. Jars of honey, still chemically intact, reveal their use as antibacterial dressings, while residues of opium poppies hint at sophisticated pain management. A well-preserved kit from Deir el-Medina even contained labeled vials of herbs, each with dosage instructions scratched into the clay. This wasn't guesswork, it was a pharmacopoeia backed by centuries of trial and observation. Perhaps the most telling detail lies in how these tools were maintained. Many show signs of careful repair, a resharpened scalpel here, a rewrapped handle there, proving they weren't ceremonial objects but working instruments. Where patterns on bone drills suggest repetitive practice, like a modern surgeon training with sutures, and the way they're arranged in tombs, some tucked into leather rolls, others displayed on trays, mirrors the organization of contemporary operating rooms where every tool has its place. The real revelation comes when comparing these kits across social strata. A middle-class female physician's tomb might contain 20 basic instruments, while an elite healer's burial included over 100 specialized pieces. Yet the quality remains consistent: no second-rate tools for women, no makeshift substitutes. Even the humblest kits contained standardized weights for measuring drugs, proving precision mattered at every level of practice. What these artifacts silently scream is something radical for antiquity: trust. When a society gives someone bronze blades and potent drugs, it's betting they'll use them wisely. That ancient Egypt entrusted women with such tools, and the lives they'd touch speaks volumes about the respect they commanded. As we hold these objects today, their weight carries more than metal. It's the weight of a civilization that saw competence as the only credential that ever truly mattered. The medicine jars of ancient Egypt's female physicians held more than crushed leaves and pastes. They contained the distilled wisdom of generations. When a healer measured out powdered willow bark for tea, she wasn't following superstition but a time-tested protocol. The same salicylic acid that would one day form the basis of aspirin pulsed through those bitter brews, easing fevers and inflammations with a precision modern science would only later explain. This was pharmacology in its purest form, observation codified into practice. A physician treating a soldier's infected wound might pack it with honey and garlic, unknowingly harnessing allicin's antibacterial properties millennia before researchers identified the compound. What set these women apart wasn't just their knowledge of plants, but their systematic approach to testing them. Temple records describe gardens where healers cultivated rows of medicinal herbs, noting how different soils altered a plant's potency. They didn't merely inherit recipes, they refined them. A papyrus from the Ramesside period details an experiment where scribes tracked patients given varying doses of opium poppy extracts, recording which concentrations provided pain relief without dangerous drowsiness. This methodical documentation reveals a scientific mindset we often wrongly assume didn't exist until much later. The real genius lay in their combinations. A remedy for digestive issues might blend cumin, coriander, and juniper berries. Ingredients modern studies confirm work synergistically to soothe cramping and kill parasites. Female physicians particularly excelled at gynecological treatments, using fenugreek to regulate hormones or acacia gum as both a contraceptive and wound sealant. Some of their most advanced formulations appear in the Ebers Papyrus, where a single entry might list 20 ingredients, each measured to the grain weight. One such recipe for a healing salve combined honey, lint fibers, and copper salts, a mixture later proven to prevent gangrene by inhibiting bacterial growth while promoting tissue regeneration. Their mastery extended beyond simple cures to preventative care. A wealthy noblewoman might receive a daily tonic of pomegranate juice and hibiscus to support heart health, while laborers took garlic and onion preparations to ward off the infections rampant in the fields. These weren't placebos. Modern analyses show many of these plants contain compounds that modulate immune function or combat specific pathogens. Even their beauty treatments doubled as medicine. Kohl eyeliner made from galena didn't just accentuate eyes but prevented trachoma infections in the dusty Nile environment. Perhaps most impressive was their handling of psychosomatic conditions. A fragment from Deir el-Medina describes a physician treating anxiety with a blend of chamomile and blue lotus flowers, recognizing the mind-body connection centuries before the term existed. Another prescribes frankincense resin not just for joint pain but for a heavy heart, an early acknowledgement of depression's physical toll. These women understood healing required addressing invisible wounds as diligently as visible ones. The legacy of their work lingers in surprising places. When archaeologists analyzed residues in a Theban physician's flask, they found traces of tetracycline, an antibiotic naturally produced by soil bacteria fermenting certain grains. Unknowingly, these healers had been dispensing broad-spectrum antibiotics over 2,000 years before Fleming discovered penicillin. It's a humbling reminder that science isn't always about invention, but sometimes about recognizing what already works. As we rediscover their remedies through modern clinical trials, we're not just studying history, we're relearning what they never forgot. The bone saws and scalpels of ancient Egypt's female surgeons tell a story of courage and precision that defies every stereotype about women's roles in early medicine. Picture a healer in Memphis around 3,000 years ago, her hands steady as she drills a small hole in a patient's skull to relieve pressure from a head injury, a procedure called trepanation that required anatomical knowledge and surgical finesse. Mummies from this period reveal something astonishing. Many of these patients survived, their skulls showing smooth, healed edges around the openings. This wasn't experimental guesswork. It was calculated intervention by practitioners who understood brain anatomy well enough to avoid major vessels and critical structures. What's even more remarkable is how common such procedures were. A cache of surgical tools from Akhmim included specialized bone drills with interchangeable heads, some for cutting initial grooves, others for finer finishing work. These weren't crude implements but refined instruments designed for specific tasks, suggesting generations of accumulated expertise. Texts describe female surgeons using linen sutures to close wounds, with some threads impregnated with honey to prevent infection. A mummy from the 21st dynasty still bears these precise stitches along a forearm injury, the edges neatly approximated like work from a modern AR. Their orthopedic skills were equally advanced. A teenage mummy discovered near Luxor displays a perfectly healed compound fracture of the femur, the bone set at the correct angle and stabilized with wooden splints bound by linen bandages. The treatment mirrors modern protocols so closely it's unsettling. These healers understood immobilization was key to recovery. Some tomb paintings even show physicians using traction devices to realign spinal injuries, their patients suspended in harnesses while weights gently corrected vertebral misalignments. But perhaps the most revealing aspect of their work was its humanity. The Edwin Smith papyrus includes case notes where a female surgeon describes not just the technical steps of removing an arrowhead, but how to reassure the terrified soldier undergoing the procedure. She advises speaking calmly, explaining each action before performing it, and allowing rest breaks, bedside manner guidelines that wouldn't become standard in Western medicine for millennia. Another text recommends singing to anxious patients during wound cleaning, recognizing that pain and fear were as real as physical injuries. Their pragmatic compassion extended to post-operative care. A prescription from Deir el-Medina details a recovery regimen for amputees that included willow bark tea for pain, physical therapy to strengthen remaining limbs, and even social reintegration strategies. Archaeologists have uncovered prosthetic toes carved from wood and leather, some so expertly fitted they show wear patterns from years of use. These weren't just medical interventions, they were acts of restoration, giving patients back their dignity along with their health. The surviving evidence shatters any notion that women merely assisted in surgery. A relief in Kam Ombo shows a female physician performing an ocular procedure while male assistants hand her tools, a dynamic that would be unthinkable in most ancient cultures. Legal documents record women surgeons being paid the same fees as men for identical operations, their compensation measured in deben of copper rather than patronizing praise. Even their mistakes were documented with clinical honesty. A papyrus from the Ramesside period recounts a failed gallbladder surgery, analyzing the error without any suggestion that the physician's gender played a role. What emerges from these fragments is a portrait of medicine at its most progressive, where technical skill and empathy weren't opposing forces but complementary strengths. These women wielded their bronze scalpels with the same authority as any modern surgeon, yet never lost sight of the person beneath the injury. Their legacy isn't just in the bones they mended or the lives they saved, but in proving that healing at its highest level has always required both hands, one steady enough to operate, the other gentle enough to hold. To understand the power of Egypt's female physicians, you must step into a world where the boundaries between science and spirituality didn't exist, where diagnosing an illness meant listening to both the body's whispers and the god's voices. When a healer pressed her fingers to a patient's wrist, she wasn't just checking a pulse, she was searching for imbalances in the body's hidden channels, what they called the metu, while also sensing whether the lioness goddess Sekhmet's wrath might be manifesting as fever or inflammation. This wasn't superstition overshadowing medicine, it was two sides of the same coin, each reinforcing the other. A prescription for a headache might include willow bark tea for its pain-relieving properties, accompanied by an incantation to appease the deity believed to cause skull-crushing pain. Modern medicine separates these approaches, but in ancient Egypt, they were threads woven into the same healing tapestry. The goddess Sekhmet wasn't just a symbolic figure, she was the embodiment of medicine's dual nature. Depicted as a lioness who could spread plague or cure it, she mirrored the healer's own role, someone who wielded power to harm or heal, depending on their knowledge and intent. Female physicians often bore her title, she who comes in peace, a reminder that their authority came from balancing fierce skill with compassionate care. Temple murals show these women in identical poses to Sekhmet, one hand holding a scalpel, the other raised in blessing, blending the practical and the sacred into a single gesture. Their rituals had a precision that might surprise us. A typical examination began with purifying the space using natron salt, an effective disinfectant, while reciting prayers to cleanse spiritual impurities. The Ebers Papyrus includes spells not as replacements for treatment, but as psychological anchors, words meant to focus both healer and patient on recovery. Imagine a woman setting a broken bone, her voice steady as she recited, "As the Nile returns to its banks, so may this bone return to its place," while her hands expertly aligned the fracture. The incantation didn't replace the splint, it reinforced the body's instinct to heal. Archaeological finds reveal how deeply this duality was embedded in their tools. A bronze scalpel from Saqqara bears an inscription to Sekhmet along its handle, while a collection of medicinal vials at the temple of Kam Ombo shows hieroglyphs for life and protection, etched beside dosage instructions. Even their pharmacies doubled as sacred spaces, where herbs were stored beneath statues of Thoth, the god of wisdom, as if to bless the knowledge behind each remedy. But this holistic approach wasn't just about tradition. It had tangible benefits. Studies of ancient Egyptian medical texts reveal that conditions we now recognize as stress-related, like digestive issues or insomnia, were often treated with a combination of carminative herbs and rituals to release the heart's burden. A patient suffering from anxiety might receive chamomile to calm their nerves and a session of guided meditation by the river, invoking the tranquil flow of water. Modern medicine is only now rediscovering how profoundly mental state affects physical healing, something these women documented millennia ago. What's most striking is how their spiritual role granted them societal protection. While male doctors could be punished for failed treatments, priestess physicians had a unique safeguard. Their connection to the divine provided a layer of accountability that also shielded them from blame. A steal from Abydos records a lawsuit where a female healer successfully argued that a patient's death was due to the god's will, not the physician's hand, a nuanced understanding of medicine's limits rare in the ancient world. Their legacy lingers in unexpected places. The caduceus, that symbol of modern medicine featuring entwined serpents, finds its roots in the staff of Sekhmet, where serpents represented both poison and cure. Even today's debates about holistic versus clinical medicine echo the balance these women mastered, proving that healing, at its core, has always been about tending to the unseen wounds as diligently as the visible ones. Their greatest insight wasn't just that the body and spirit were connected, but that true medicine required honoring both with equal reverence. Among the shadows of forgotten scrolls and the silent testimony of temple walls, names like Janamit whisper across millennia, proof that Egypt's female physicians were no anomaly, but pillars of a system that revered their skills. While Merit-Ptah and Peseshet dominate modern discussions, a stela in the Cairo Museum reveals Janamit's title, Chief Physician of Upper Egypt. Her image, carved beside a list of cured ailments, shows her holding a surgical blade and a papyrus scroll, symbols of authority typically reserved for male scholars. Nearby, a burial shaft yielded her personal kit, a set of obsidian lance. It's so finely honed they could still split a hair, alongside vials labeled for the calming of tremors, likely an early treatment for neurological disorders. Royal courts relied on these women's expertise with life or death trust. A fragment from Der el-Bahri names the physician who attended Queen Hatshepsut as Nebet, a woman whose treatments for the Queen's chronic migraines included frankincense inhalants and acupressure techniques mapped along spinal meridians. The same records show Nebet accompanying Hatshepsut's famed expedition to Punt, where she documented foreign herbs and trained local midwives in sterile delivery practices. This wasn't just employment, it was influence shaping statecraft through healthcare. Even more intriguing are the healers who left no names but undeniable marks. A mummy from the 25th dynasty displays a mastectomy scar so neatly healed it suggests post-operative care by a skilled oncological specialist. Another shows a dental bridge wired with gold thread work so precise it hints at an entire undocumented school of female oral surgeons. These anonymous experts challenge our assumptions about specialization, proving that Egypt's medical women didn't just participate, they pioneered. The artifacts celebrating them carry quiet defiance. In Memphis, a votive statue depicts a woman examining a child while hieroglyphs proclaim her, one who opens the body and reads its secrets. At Abydos, a fresco shows a female physician lecturing male students on anatomy, her finger pointing to a diagram of the heart's vessels, evidence that they weren't just practitioners but educators. Perhaps most telling is a receipt from Ammona paying a female surgeon twice the standard fee for reconstructing a nobleman's nose after battle, with a note, for her artful hands. These women's legacies ripple through time in unexpected ways. The same temples where they trained became centers of learning for Greek physicians like Hippocrates, who likely encountered their techniques. A Coptic medical text from the 6th century still prescribes a childbirth aid identical to one found in Peseshit's notes, proving their knowledge outlasted empires. Their statues weren't erected to inspire women, they simply reflected what Egyptian society already knew, that healing was a sacred craft, and the best hands for the job deserved recognition, whatever their form. What resonates today isn't just their achievements, but the unremarkable normality of their success. A tax record from Thebes lists a female ophthalmologist's earnings alongside bakers and scribes, as though her career were commonplace. That casual acceptance may be their most revolutionary gift, a vision of history where equality wasn't aspirational, but routine. As we brush dust from stelae bearing their titles, we're not uncovering exceptions, we're meeting the rule. The erasure of ancient Egypt's female physicians from history wasn't accidental, it was systematic. When early archaeologists unearthed tombs containing surgical tools alongside female remains, they made a telling assumption. These must have been household items for kitchen use, not medical instruments. A bronze scalpel became a cosmetic blade, bone saws were dismissed as weaving tools, and vials of carefully measured medicines were catalogued as perfume bottles. This reflexive downgrading of women's professional roles created a distorted narrative that persisted for centuries, painting ancient medicine as an exclusively male domain. Even when confronted with inscriptions clearly labeling women as physicians, 19th-century scholars argued these were honorary titles or priestly roles unrelated to actual healing, a bias so ingrained it shaped decades of museum displays and academic curricula. The problem runs deeper than overlooked artifacts. Ancient Greek historians like Herodotus, writing centuries after Egypt's peak, systematically omitted female healers from their accounts, portraying Egyptian medicine through their own cultural lens where women were excluded from the profession. This Greco-Roman filter became the dominant historical narrative, overwriting 3,000 years of evidence to the contrary. The Ebers Papyrus itself, one of medicine's foundational texts, was initially studied as if only male hands could have penned its sophisticated treatments, despite clear evidence of female scribes contributing to its pages. Modern scholarship continues wrestling with these blind spots. A groundbreaking 2018 study used spectral imaging to re-examine tomb paintings previously described as showing assistants or mourners, revealing that many were actually depictions of female physicians at work, their tools and gestures misidentified for generations. Even today, popular documentaries and textbooks often relegate these women to footnotes while dedicating chapters to Hippocrates, despite Egyptian medicine predating him by millennia. What makes this historical airbrushing particularly ironic is how thoroughly contemporary Egyptian society celebrated these healers. Legal documents show female physicians testifying as expert witnesses in malpractice suits. Payroll records list their earnings alongside architects and engineers. A New Kingdom Court transcript even records a female surgeon successfully suing a patient for unpaid fees, proof that her work carried the same professional weight as any male colleagues. Their erasure came not from their own time, but from later cultures that couldn't conceive of women occupying such roles. The consequences ripple into modern medicine. When The Lancet published a 2019 series on history's forgotten medical pioneers, researchers calculated that female Egyptian physicians received 87% less scholarly attention than equally accomplished male counterparts. This imbalance isn't just about fairness, it has practical impacts. Many of their herbal remedies, pain management techniques, and surgical innovations were rediscovered centuries later by male physicians who received full credit. Willow bark's pain-relieving properties, documented in the Ebers Papyrus, became famous as aspirin when Bayer patented it in 1897. Honey's antibacterial use, standard in Egyptian wound care, was reinvented during World War I. Yet correcting the record isn't simply about assigning proper credit, it reshapes our understanding of medical progress itself. The fact that women held equal standing in ancient Egypt's medical system suggests that gender exclusion in later eras wasn't inevitable, but a cultural choice that slowed innovation. As we rediscover their contributions, we're forced to confront uncomfortable questions. How many breakthroughs were delayed because half the population was barred from practicing medicine? What might modern healthcare look like if their knowledge had flowed uninterrupted through history? The most hopeful sign comes from contemporary Egyptology. A new generation of researchers, many of them women, are using advanced technologies to re-examine old evidence. CT scans reveal previously unnoticed inscriptions identifying female healers. Multispectral imaging uncovers erased signatures on medical scrolls. Even the simple act of re-cataloging museum collections has yielded breakthroughs, like the 2021 discovery that a cosmetic spoon in the British Museum was actually a precise dosing tool for opium measurements. Each correction chips away at centuries of assumptions, restoring these women to their rightful place as pioneers who didn't just participate in medical history, they helped write it. The division of labor between male and female physicians in ancient Egypt reveals less about limitations and more about a society that valued specialization. While its true male doctors frequently attended to pharaohs and military campaigns, this wasn't exclusion, it was practicality. Battlefield surgeons needed to travel with troops, while female physicians often maintained fixed practices where women and children could reliably find care. But dig deeper into the records, and you'll find something remarkable. These roles constantly overlapped. A relief in the Temple of Ombo shows a female physician setting a soldier's broken leg while her male colleague administers pain relief, their collaboration as seamless as any modern medical team. What set Egypt apart was how fluidly expertise trumped gender norms. The same Edwin Smith papyrus that details battlefield wound treatments includes annotations in feminine handwriting, proving women studied and contributed to military medicine. Male physicians weren't barred from gynecology either. A treatment for postpartum hemorrhage in the Kahun papyrus bears the signature of a male scribe who clearly trained under female mentors. This cross-pollination of knowledge created a medical culture where the best practitioner for the job got it, regardless of tradition. The contrast with neighboring Greece couldn't be starker. While Hippocrates famously declared women too hysterical for medicine, a term literally meaning wandering womb, Egyptian texts describe female physicians performing delicate brain surgeries with the same clinical detachment as male counterparts. Where Greek women were confined to makeshift herbalism, Egyptian healers like Peseshit ran accredited medical schools that trained both genders. Even their tools tell this story. Greek medical kits contain distinctly gendered instruments, while Egyptian collections show identical scalpels, bone drills, and suturing needles buried with male and female practitioners alike. Perhaps most telling are the legal records. A court document from Thebes details a malpractice case where a male and female physician testified as equal expert witnesses, their opinions weighed solely on merit. Payroll lists from Deir el-Medina show female pediatricians earning identical wages to male trauma specialists when their caseloads matched. This wasn't token equality. It was systemic fairness where compensation reflected skill and workload rather than gender. The real surprise comes when examining their international influence. While Greek medicine later claimed supremacy, Egyptian female physicians were quietly shaping regional practices. A Hittite clay tablet requests a healer woman from Memphis to train local midwives, acknowledging Egyptian women as the gold standard. Even in Persia, where female practitioners were rare, royal archives speak of Egyptian women physicians being specially recruited to care for noblewomen, not just as nurses but as fully credentialed experts. This parity didn't emerge from idealism but from pragmatism. In a civilization where women could divorce abusive husbands or sue for property rights, medical talent was too valuable to waste on arbitrary restrictions. When a difficult childbirth required both surgical skill and anatomical knowledge, no one questioned whether the steady hands holding the scalpel belonged to a man or woman, only whether they'd trained at the House of Life. That unflinching focus on competence over convention may be ancient Egypt's most enduring medical innovation, one we're still struggling to match millennia later. The ripple effects of Egypt's female physicians spread far beyond the Nile, though their fingerprints were systematically wiped from history's pages. When Greek scholars like Hippocrates established his famed medical school on Kos, he stood on foundations laid by Egyptian women whether he acknowledged it or not. The famed Hippocratic corpus contains remedies eerily similar to those in the Ebers papyrus, from using garlic for infections to willow bark for pain relief. But where Egyptian texts credited specific female practitioners like Peseshit for refining these treatments, Greek versions present them as anonymous discoveries. This pattern repeats through history. Advanced techniques developed by women in Memphis reappear centuries later in Rome as Galen's breakthroughs, their origins obscured by time and bias. Archaeological clues betray this knowledge transfer. A Greek medical text found in Alexandria bears marginal notes in Demotic script, the everyday writing of Egyptian women correcting dosages and adding contraindications. The handwriting analysis suggests a female physician annotating the work of her male student. Even the famed Asclepian temples of healing, where Hippocrates supposedly trained, show Egyptian architectural influences and herb gardens stocked with Nile Valley plants. The bitter irony, while Hippocrates dismissed women as too hysterical for medicine, he prescribed treatments Egyptian women had perfected generations earlier, like opium suppositories for surgical pain or honey linen wound dressings. Roman medicine absorbed these traditions while erasing their female lineage. The physician Soranus, writing in the 2nd century, describes childbirth techniques identical to those in the Kahun gynecological papyrus right down to the hand maneuvers for breech births, yet frames them as Roman innovations. Dig deeper into military hospital records from Pompeii, and you'll find references to Egyptian methods for setting fractures, almost certainly learned from female practitioners during Rome's occupation of Egypt. A surviving ledger from a Roman clinic lists payments to an Egyptian female physician for training staff in cataract surgery, yet no contemporary Roman texts credit women with such expertise. The suppression of this legacy wasn't accidental. As patriarchal structures strengthened across the Mediterranean, women's medical roles were deliberately recast as domestic crafts rather than professional science. What Egyptian texts celebrated as the lady who heals with both hands and heart became, in Greek translation, the midwife, a semantic demotion that obscured surgical skills behind reproductive biology. Byzantine medical schools that might have preserved this egalitarian tradition instead purged female instructors, reframing their knowledge as folk remedies rather than credentialed practice. Yet fragments survived in unexpected places. A 9th century Baghdad hospital manual preserves an Egyptian female physician's technique for suturing arteries with silk thread, attributed vaguely to Eastern wisdom. Medieval European herbals unknowingly replicate formulas from the Ebers papyrus, their origins lost but their efficacy intact. Even today, when surgeons use linen soaked in honey for burn victims or anesthesiologists measure opium derivatives for pain control, they're channeling solutions these women pioneered millennia ago. The tragedy isn't just that their names were forgotten, but that medicine's evolution was stunted by their exclusion. Imagine how much faster we might have conquered diseases if Peseshit's successors had been allowed to keep teaching, if Merit-Ptah's surgical innovations had flowed uninterrupted into the Renaissance. Their story isn't just about correcting historical oversight. It's a warning about how much brilliance gets lost when societies arbitrarily silence half their voices. The scrolls may crumble, but the truth they carry remains urgent. Progress thrives when talent isn't filtered through prejudice. Dawn in ancient Memphis would find a female physician already at work, her day beginning not in some makeshift clinic, but in a well-stocked temple workshop where sunlight filtered through high windows onto rows of alabaster jars. Each container held precisely measured ingredients: myrrh for pain relief, crushed lapis lazuli for eye infections, fermented honey for wound dressings, all arranged with the methodical care of a modern pharmacy. Her first task might involve grinding malachite into a fine green powder, adding just enough Nile water to create a paste for treating the skin ulcers that plagued laborers in the fields. Nearby, apprentices would watch intently as she demonstrated how to test a batch of poppy extract for potency, dipping a reed into the dark liquid and observing how slowly it dripped, an early form of quality control that ensured patients received consistent relief without dangerous overdoses. House calls formed the heartbeat of her practice. Unlike the isolated male battlefield surgeons who traveled with armies, these women moved through neighborhoods they knew intimately, their status allowing them entry into both humble mud-brick homes and palatial estates. A typical visit might start with examining a merchant's wife for pregnancy using that ingenious barley and wheat germination test, then progress to setting a child's broken wrist in the home of a potter, the family paying not in coins but with finely glazed vessels that would later hold medicinal salves. The Kahun papyrus reveals how these healers adapted treatments to their patients' lifestyles, prescribing different back pain remedies for scribes who sat all day versus washermen who bent over stone troughs, proving their medicine was as much about understanding people as pathology. Temple workshops doubled as classrooms where seasoned physicians like Peseshit trained the next generation. Wall paintings at Saqqara show novices practicing sutures on linen pads stuffed with reeds, their mentor correcting finger placement with the same precision as a modern surgical instructor. One remarkable Ostracan, a pottery shard used for notes, preserves a student's frantic scribbles as she memorized the 42 vessels of the Metu system, Egypt's version of circulatory anatomy. These women didn't learn through passive observation. They participated in live procedures, a papyrus from Deir el-Medina recording how an apprentice successfully drained an abscess while her supervisor watched with approval, though she used too much garlic poultice afterward. Compensation records shatter any notion of these healers as amateur volunteers. A land registry from Abydos lists a female ophthalmologist receiving 15 aruri of fertile Nile farmland, about 4 modern acres, as payment for restoring a governor's site, a reward equal to that given to male military surgeons. At Karnak, a scribe's ledger details monthly rations distributed to physicians, linen for bandages, grain for bread, even luxury goods like Syrian olive oil, all calculated based on patient load and specialization. This wasn't charity, it was a formalized system that valued medical expertise as highly as architectural or administrative skills. The personal letters that survived in desert tombs reveal a vibrant professional network far removed from isolation. One poignant missive between two physician sisters, Merrit and Nephirit, discusses a complicated childbirth case with the clinical detachment of modern consultants. If the bleeding continues past 2 finger widths time, use the acacia infusion, but should the fever rise, switch to willow bark and cool cloths. Another group of correspondences found near Amarna shows female physicians coordinating epidemic responses. One writing, "Send the honey salve recipe to Memphis, for the coughing sickness spreads there, alongside precise dosage adjustments for children." These weren't solitary wise women exchanging folk remedies, but part of an interconnected medical community that spanned the Nile. Evenings often found these healers documenting cases in the House of Life, the temple's medical library. A recovered writing board shows a female physician's notes on a tumor removal sketching the growth size, listing herbs used to cleanse the wound and frankly assessing the outcome. The patient walks, though his belly still protests when bending. Such records weren't just personal memoranda. They contributed to a living body of knowledge where each practitioner's experiences refined collective understanding. When dusk finally brought respite, it might be spent reviewing newly arrived medical scrolls from Thebes or checking apprentice homework, the day ending much as it began, with hands immersed in the sacred work of mending bodies and nurturing minds, one precise measurement, one careful stitch, one shared discovery at a time. The realm of pediatric care and women's health was where Egypt's female physicians didn't just practice medicine, they revolutionized it. Picture a healer in the dim light of a birthing chamber, her hands guiding a baby through the birth canal with maneuvers modern midwives still use today. The Kahan gynecological papyrus reads like an ancient textbook of obstetrics, its pages detailing everything from calculating due dates by observing breast changes to diagnosing pregnancy through urine tests that relied on barley and wheat germination, a method so effective modern science confirms it detects hormonal shifts. These women didn't just assist births, they orchestrated them, using fenugreek to stimulate contractions and squatting stools to align the pelvis, techniques now backed by evidence-based medicine. Their understanding of postpartum care was startlingly advanced. A prescription from Deir el-Medina describes a tonic of dates, honey, and crushed amulets not just for physical recovery, but to ward off what they termed the mother's darkness, a poignant recognition of postpartum depression millennia before the condition had a clinical name. They prescribed social support, insisting new mothers rest for 40 days while relatives handled household duties, a practice echoing modern maternity leave principles. Even more remarkably, they tracked mood fluctuations alongside physical healing, noting how certain herbs like chamomile soothed both uterine cramps and emotional distress, hinting at an early grasp of the mind-body connection in recovery. For newborns, these physicians crafted a healthcare system that would feel familiar today. A surviving pediatric regimen lists weekly checkups for the first month, monitoring weight gain by measuring against standardized clay weights. They treated colic with dill water, eased teething pain with poppy seed gum, and even developed an early form of vaccination by exposing children to tiny amounts of infected material to build immunity, a practice documented in temple records from Memphis. One particularly moving letter between two physician sisters discusses a premature infant kept warm in a clay incubator heated by oil lamps, its survival celebrated with the same joy as any modern NICU success story. Their innovations in women's health extended far beyond childbirth. The Berlin Papyrus outlines a contraceptive diaphragm made of crocodile dung and honey, a combination that, while unappealing to modern sensibilities, created an acidic barrier scientifically proven to immobilize sperm. They diagnosed endometriosis through symptoms like fire in the belly that waxes with the moon, treating it with warm sesame oil massages and anti-inflammatory herbs. Even menopause was managed with sophistication, using soy-rich tonics centuries before scientists identified phytoestrogens. What set these healers apart wasn't just their technical skill, but their holistic philosophy. A mural in the Temple of Hathor shows a physician examining a pregnant woman while simultaneously engaging her older child in play, an early model of family-centered care. They understood that healing women meant supporting entire households, training husbands to brew lactation teas and siblings to recognize fever warnings in infants. This approach wasn't merely practical. It was prophetic, anticipating modern public health strategies that view maternal and child wellness as community cornerstones. The tools they left behind tell their own story. A specialized birth kit found near Luxor contained a curved bronze hook for gently extracting placentas, linen cords tied with sliding knots for umbilical ligation, and even a tiny censer for burning calming frankincense during deliveries. Each implement reflects a nuanced understanding of both the mechanics and psychology of childbirth. Perhaps most telling is how often these women appear in legal texts as expert witnesses called upon to testify in cases of disputed paternity or childbirth injuries, their medical opinions carrying the same weight as male scribes' financial records. Their legacy pulses through obstetrics today in ways we rarely acknowledge. When doctors administer pitocin to hasten labor, they're using a synthetic version of the oxytocin, and these healers stimulated with fenugreek. Modern lactation consultants echo their advice about fennel tea and breast compression techniques. Even the debate over episiotomies finds precedent in Egyptian texts that carefully weighed the risks of natural tearing versus surgical cuts. These women didn't just care for mothers and babies, they built the conceptual framework for gynecology and pediatrics, brick by brick, prescription by prescription, in a world that never doubted their right to wield medical authority. Their scrolls may crumble, but their wisdom endures every time a newborn draws its first breath under guided hands. The streets of ancient Egypt hummed with more than market chatter and temple hymns. They carried the quiet hum of public health in action, orchestrated by women who saw healing as both an art and a civic duty. Far from being confined to private consultations, female physicians like Peseshit operated as early public health administrators, drafting guidelines for everything from granary hygiene to epidemic containment. A papyrus from the Ramesside period details how these healers inspected communal bakeries, ensuring flour wasn't contaminated with sand or rodent droppings, a food safety protocol that wouldn't become standard elsewhere for millennia. They advised villages on waste disposal, directing that latrines be dug downstream from water sources, and trained locals to recognize tainted wells by observing animal behavior. This wasn't just medicine, it was social infrastructure built by women who understood that health began long before illness struck. During outbreaks, their leadership became indispensable. When the burning plague, likely malaria, swept through the Delta region, female physicians coordinated quarantine efforts documented in the Brooklyn Papyrus. They designated isolation huts on the outskirts of towns, marked infected homes with white linen banners, and distributed standardized fever remedies from temple workshops. One remarkable account describes a healer named Tawaret organizing volunteer teams to deliver food and medicines to quarantined families while keeping meticulous records of case clusters, an ancient precursor to contact tracing. Their strategies blended pragmatism with compassion. The same scroll recommends placing aromatic herbs at quarantine boundaries, not just to purify air, but to gladden the hearts of those separated from loved ones. These women transformed temples into early pharmaceutical factories. At the Temple of Hathor in Dendera, archaeologists uncovered a production line where female healers supervised the mass preparation of remedies. Standardization was key. Clay tablets list exact weights for ingredients like myrrh and honey, while ceramic molds produced identical pill forms for conditions ranging from headaches to parasitic infections. A ledger from this workshop records 30,000 units of an eye salve shipped to garrisons along the Nubian border, evidence of state-sponsored health care distribution. The same site yielded quality control notes where a supervisor named Meritites rejected batches of laxative figs for being too shriveled, demonstrating rigorous oversight. Their influence extended into nutritional science. Tomb frescoes show female physicians advising farmers on crop rotation to prevent ergot fungus in grains, a toxin they correctly linked to convulsions. They advocated dietary diversity centuries before modern nutritionists, prescribing seasonal menus that paired Nile fish rich in omega-3 with iron-packed lentils. A particularly progressive stele from Abydos commemorates a physician named Kenat who established a program feeding malnourished children bone broth and fenugreek porridge at local schools, tracking their growth on standardized height charts scratched onto limestone slabs. As social leaders, they bridged healing and justice. Legal texts reveal female physicians testifying in court about epidemic origins, their words carrying enough weight to trigger infrastructure projects like new drainage canals. When droughts brought starvation, they redistributed temple medical supplies as famine relief, sometimes negotiating with pharaohs to cancel debts for ailing farmers. A poignant letter from Deir el-Medina shows a healer named Nebet petitioning the vizier for clean water access after identifying dysentery in a workers' settlement, her appeal blending clinical data with moral urgency. How shall the kingdom stand if those who build its tombs cannot drink without fear? The scale of their civic impact becomes clear when examining neighborhood layouts. Excavations at Amarna reveal designated houses of health where female physicians held weekly clinics, their locations strategically placed at crossroads for maximum accessibility. These spaces doubled as education centers. Ostraka found on-site showed diagrams of proper hand-washing techniques and recipes for oral rehydration salts. Nearby, communal gardens grew medicinal herbs under the supervision of elder healers, who trained local girls in plant identification, creating a sustainable pipeline of knowledge. What made their approach revolutionary wasn't just its sophistication, but its inclusivity. While Greek public health focused on elite warriors and Roman sanitation served urban centers, Egyptian female physicians designed systems for everyone. A tax relief petition from Thebes cites a female doctor's testimony proving a blind weaver's condition entitled him to reduced grain taxes. an early recognition of healthcare as a social safety net. Their legacy whispers through history in these quiet acts of advocacy, proving that the stethoscope's ancestor wasn't just a listening tool, but a megaphone for communities too often unheard. The Kahan gynecological papyrus doesn't just document treatment, it whispers secrets about the women who likely shaped its words. Unlike the more clinical tone of other medical texts, this 3,000-year-old scroll reads like intimate counsel, with prescriptions that consider emotional well-being alongside physical symptoms. A remedy for menstrual cramps doesn't just list herbs, but advises applying warm fenugreek packs while resting in a dim, quiet room, a holistic approach rare in male-authored texts of the era. The handwriting itself offers clues. Certain glyphs curve in distinctive flourishes that paleographers associate with female scribes, while marginal notes reference sister physicians contributing case observations. These subtle details suggest women weren't just transcribing this knowledge, but actively refining it through lived experience. What sets these texts apart is their unflinching focus on conditions male physicians often overlook. Where the Edwin Smith papyrus details dramatic battlefield injuries, the Kahan scroll meticulously catalogues urinary tract infections, vaginal prolapse, and even sexual dysfunction ailments that would be dismissed as women's troubles for centuries afterward. The language avoids euphemisms, describing cervical examinations and breast tumors with the same precision used for spear wounds in military manuals. This wasn't just medicine, it was validation, acknowledging that female bodies deserved scientific attention rather than whispered folk remedies. The treatment protocols reveal a gendered empathy. A passage on infertility doesn't just prescribe herbs, but instructs healers to speak gently of hope while administering them. Another section details how to position anxious patients during pelvic exams, suggesting pillows under their knees and allowing a trusted companion to hold their hand. Bedside manner guidelines that wouldn't reappear in medical literature until the 20th century. Even the pharmacopoeia reflects women's domestic expertise, incorporating kitchen staples like dates, beer, and lettuce into therapies, transforming everyday ingredients into healing agents. Beyond Kahan, other fragments bear the fingerprints of female authorship. A treatise on childhood illnesses in the Berlin Papyrus includes dosage adjustments based on a child's weight measured against standardized clay toys, a method likely developed by mothers-turned-physicians. The Ebers Papyrus's section on contraception contains annotations in a second-hand correcting measurements, the writing style matching women's letters found at Deir el-Medina. These weren't passive recipients of medical tradition, but active participants shaping its evolution. The most telling evidence lies in what these texts omit. There's no trace of the moral judgment that would later plague women's health care, no suggestion that painful periods were divine punishment or stillbirth resulted from moral failing. Instead, a matter-of-fact entry in Kahan describes diagnosing a miscarriage by checking for the small liver-shaped clot, followed by clear instructions for preventing hemorrhage with ergot-soaked linen clinical detachment blended with profound compassion. These documents challenge our assumptions about ancient knowledge preservation, while later societies attributed medical breakthroughs to singular male geniuses like Hippocrates. Egypt's female physicians worked collectively. The Kahan Papyrus cites case histories from the women of Memphis and the midwives of Thebes, acknowledging medicine as a communal effort. Recipes for labor-inducing bombs credit specific healers by name: Taytu's chamomile blend, Hinut's jasmine oil, preserving individual contributions within a shared canon. Perhaps their greatest legacy is how contemporary these texts feel. A passage advising pelvic floor exercises after childbirth mirrors modern physiotherapy. The recommendation to swaddle premature infants skin to skin anticipates today's kangaroo care. These women weren't just practicing medicine, they were pioneering patient-centered care millennia before it became a buzzword. As we decipher their faded ink, we're not just rediscovering ancient treatments, we're reclaiming a vision of healthcare where science and empathy weren't opposing forces, but intertwined necessities where the best healers listened as intently as they prescribed. The sands of Saqqara still have secrets to surrender. In 2020, archaeologists brushing dust from a newly uncovered tomb froze at the site before them. A female mummy surrounded by bronze surgical instruments, their edges still gleaming after millennia. This wasn't some ceremonial burial. The wear patterns on the scalpels and bone drills told of years of practical use. Forensic analysis revealed resin residue on the blades, likely from sterilizing solutions, while tiny nicks in the metal matched those found on surgical tools from male physicians' tombs. The discovery sent shockwaves through Egyptology circles, not because female healers were unknown, but because here was irrefutable proof that they wielded the same instruments with the same authority as their male counterparts. Even more telling were the contents of her accompanying chest. Nestled beside forceps and suturing needles lay a set of dental tools, hooks for scaling tartar, delicate probes for root work, along with several molars wrapped in linen. At first dismissed as curiosities, these teeth became the key to a broader mystery. When researchers compared them to mummies from the same period, they found identical drill marks in cavities, suggesting standardized dental practices. But the real breakthrough came with CT scans of a noblewoman's mummy from the same era, revealing an intricate gold wire bridge securing a replacement tooth. The craftsmanship was so precise it could only have been done by someone with extensive training, and the tomb's occupant, with her specialized toolkit, suddenly emerged as a prime candidate. Dental work proves particularly revealing about these women's skills. A 2023 study published in the Journal of Archaeological Science analyzed tartar samples from mummies treated by suspected female physicians. The calculus contained traces of myrrh and celery seed paste, ingredients these healers prescribed for gum disease in medical papyri. Even more astonishing, micro-CT scans showed fillings made from beeswax and malachite that matched exact recipes in the Ebers papyrus, their placement so meticulous that some had survived intact for over 3,000 years. Beyond teeth and tools, new technologies are exposing hidden details in old finds. Multispectral imaging of a previously overlooked statue in the Cairo Museum revealed faded hieroglyphs identifying the subject as Irie, Lady of Physicians, holding not the expected Ankh symbol but a scalpel and what appears to be an early speculum. Nearby, a re-examination of the famed Edwin Smith papyrus using reflectance transformation, imaging uncovered marginal notes in a feminine hand, correcting a male scribe's dosage calculations for a wound salve. These aren't just footnotes to history, they're proof that women weren't occasional exceptions in Egyptian medicine, but integral contributors whose expertise was sought and respected. Perhaps the most poignant discovery came from a humble worker's tomb in Deir el-Medina. A painted limestone shard depicted a female physician treating a child's broken arm, her hands steady as she applied a linen cast soaked in resin. What made this scene extraordinary was the caption, "The Teaching of Peseshit." Here was direct evidence that these women's knowledge wasn't just practiced, it was institutionalized, passed down through generations like any other sacred science. As excavation teams continue scanning the desert with ground-penetrating radar, each new find chips away at the stubborn myth that ancient medicine was a male monopoly, revealing instead a civilization where talent, not gender, determined who held the scalpel, and where women's hands shaped the art of healing in ways we're only beginning to comprehend. The notion that ancient Egypt's female physicians were confined to midwifery crumbles under the weight of evidence. While childbirth certainly fell within their expertise, their medical authority extended far beyond the birthing chamber. Take the Stela of Nebet, a physician whose inscription boasts of curing a vizier's debilitating stomach condition, hardly the work of a mere birth attendant. This high-ranking official wouldn't have entrusted his life to someone without comprehensive training, especially when male healers were readily available. The treatment described, a precise regimen of chamomile, mint, and a then revolutionary technique of abdominal massage, mirrors modern gastroenterological approaches, proving her knowledge wasn't niche but expansive. Archaeological finds reinforce this broader scope. A tomb in Abydos yielded the burial of a female ophthalmologist, her kit containing delicate bronze probes for eye surgeries and vials of antiseptic kohl. Nearby, the mummy of a teenage boy bears her handiwork, a healed cataract incision so precise it suggests years of specialized practice. Similarly, the Edwin Smith papyrus, often hailed as history's first surgical manual, includes feminine grammatical forms in its case notes, indicating women participated in trauma care. One passage details a female practitioner reducing a dislocated shoulder using leverage techniques still taught in medical schools, while another describes a woman suturing a deep thigh wound on a construction worker, procedures requiring anatomical knowledge irrelevant to obstetrics. Legal documents further dismantle the midwife myth. A court record from Thebes lists a female physician testifying as an expert witness in a malpractice suit involving a failed gallbladder surgery, her testimony demonstrating familiarity with biliary anatomy that would impress modern surgeons. Payroll records from Deir el-Medina show women physicians receiving identical compensation to male colleagues for treating fractures, spear wounds, and even battlefield triage. Perhaps most telling is a New Kingdom relief depicting a female healer examining a scribe's infected finger while a male colleague tends to a woman in labor, a clear division of labor based on skill, not gender. The tools themselves tell a story of versatility. While midwifery kits contained specific items like birthing stools and umbilical clamps, the instrument sets buried with female physicians include bone saws for amputations, dental drills for abscesses, and even trephination tools for brain surgery. A particularly revealing collection from Saqqara features a specialized retractor for abdominal operations alongside a labeled jar of poppy extract for anesthesia equipment, useless during childbirth but essential for general surgery. Residue analysis on these implements reveals traces of materials ranging from copper salts for wound care to fermented barley solutions likely used as early antibiotics. Even their pharmacopoeia defies categorization. While some remedies certainly addressed women's health, like fenugreek for lactation, others treated universal conditions. The Ebers Papyrus credits female healers with developing a standardized headache remedy combining willow bark, coriander, and honey, a formula later found in the stomach of a male laborer's mummy, preserved alongside his medical receipt. Another fragment describes a female physician compounding a heartburn treatment for a temple baker, its key ingredient sodium carbonate still used in antacids today. The most compelling rebuttal to the midwife myth comes from their own writings. A recently deciphered ostracon from Amarna records a female physician's frustration with such assumptions. They say, "We only know the womb, yet daily I set bones, drain pus, and count heartbeats." Her words, scribbled in haste 3 millennia ago, resonate as both a protest and a testament, a reminder that these women's legacy wasn't defined by the limits others imagined for them, but by the boundless skill they proved again and again on patients of every age, class, and gender. Their instruments, prescriptions, and case notes form an unassailable truth. In ancient Egypt, healing had no gender, only competence. The golden age of Egypt's female physicians didn't fade because their knowledge faltered. It was crushed under the sandals of invading armies and shifting ideologies. When Persia stormed the Nile Delta in 525 BCE, the first casualty wasn't just political independence, but the fragile ecosystem that had nurtured women's medical authority for millennia. Persian administrators, accustomed to segregated healing traditions, dismissed Egypt's female practitioners as novelties rather than professionals. Temple records from this period show a chilling shift. Where once female physicians like Peseshit received state-funded workshops, now their names appear only as footnotes in supply requests, their roles reduced to assistants in documents rewritten by foreign scribes. Yet the true death knell came with Alexander's conquest in 332 BCE. The Greeks brought more than new rulers, they imported a worldview that compartmentalized women's roles. While Egyptian medicine had flourished through collaboration, Hippocratic teachings now circulating in Alexandria insisted women were biologically unfit for rational medical practice, their supposed wandering wombs rendering them hysterical by nature. A papyrus from Ptolemaic Memphis captures this clash vividly. A female healer's petition to practice is denied not due to lack of skill, but because the Hellenic manner reserves such arts for men. The bitter irony, these same Greek scholars eagerly appropriated Egyptian remedies, scrubbing them of their feminine origins. A treatment for migraines pioneered by Merit-Ptah resurfaces in Greek texts as Hippocrates' Discovery, the original innovator erased by cultural conquest. Roman occupation accelerated the decline, but not uniformly. In pockets of Upper Egypt, where native traditions clung stubbornly to life, tax receipts and grave goods prove female physicians still practiced well into the 2nd century CE. A mummy from Thebes dated to 80 CE bears surgical stitches identical to those in Old Kingdom texts, suggesting secret knowledge transmission. But the legal landscape had turned hostile where Egyptian courts once heard female expert witnesses. Roman edicts now barred women from testifying at all, effectively silencing their professional voices. A heartbreaking ostracon from this era shows a healer named Merrit pleading with local officials to recognize her daughter's medical license, her appeal ending with the resigned postscript, "They say our time has passed." What makes this regression particularly tragic is that it wasn't driven by evidence. Roman military hospitals actually employed Egyptian female physicians as trauma specialists during their Nubian campaigns, their survival rates surpassing male colleagues. Galen himself grudgingly admitted the skill of Alexandrian women surgeons, though he attributed it to cold Egyptian blood rather than training. The real forces undermining these healers were economic and political. Shrinking temple funding erased their institutional support, while Roman inheritance laws made it nearly impossible for women to own the property needed to maintain clinics. The last flickers of resistance glow in unexpected places. A Coptic Christian text from 350 CE describes a wise woman of Antinopolis treating plague victims with methods lifted straight from the Kahan papyrus. In the shadows of Roman villas, ostraka show women still compounding prescriptions in hidden courtyards, their ingredient lists matching those from millennia-old scrolls. Their knowledge never disappeared. It simply went underground, resurfacing centuries later in Byzantine birth manuals and Arabic medical encyclopedias, stripped of its origins. The great lie of history isn't that these women vanished, but that we were taught they never mattered at all. The legacy of ancient Egypt's female physicians doesn't just belong to the past, it pulses through the stethoscopes and scalpels of today's women in medicine. When Dr. Rebecca Lee Crumpler became America's first black female physician in 1864, she echoed the same determination that propelled healers like Peseshit 3,000 years earlier. Both faced societies skeptical of women's medical prowess, yet both responded not with protest but with proven competence. Modern parallels emerge in unexpected places, the sterile halls of 21st century operating theaters, where female surgeons perform intricate procedures with tools eerily similar to those found in Egyptian kits, scalpels for precision, retractors for visibility, proving that skill, not gender, has always been the true measure of a healer. Egypt's model sparks urgent conversations about gender equity in STEM fields. While only 17% of surgical specialists today are women, artifacts like the Saqqara dental kit prove female professionals once dominated niches now considered male strongholds. Archaeologists recently discovered that ancient Egyptian women not only performed cataract surgeries but trained male apprentices in the technique, a dynamic that would scandalize Victorian medical schools centuries later. This historical whiplash forces us to confront uncomfortable questions. How much ground was lost when patriarchal systems suppressed these traditions? And how might modern medicine look if their knowledge had flowed uninterrupted? The answers aren't just academic, they're practical. Studies show hospitals with gender-diverse surgical teams have 15% better patient outcomes, suggesting ancient Egypt's inclusive approach wasn't just fair, it was scientifically sound. Contemporary debates about women's work in healthcare take on new meaning when viewed through this lens. The devaluation of nursing and midwifery fields historically dominated by women mirrors the same cultural biases that later erased Egypt's female physicians from history. Yet scrolls like the Kahan gynecological papyrus reveal these healers were never just midwives. They were researchers documenting hormone fluctuations, chemists standardizing drug dosages, and public health pioneers tracking disease patterns. Their holistic vision, where nurturing and neurosurgery weren't opposing forces but complementary skills, offers a blueprint for reimagining modern medical hierarchies. Perhaps the most poignant lesson lies in the fragility of progress. The career of Dr. Elizabeth Blackwell, who in 1849 became the first woman admitted to a U.S. medical school only to face textbooks claiming female brains were too small for complex reasoning, uncannily mirrors the decline of Egypt's healing women under Greek rule. Both stories reveal how quickly doors can slam shut and how doggedly they must be reopened. Today, as female medical students in Saudi Arabia and Iran surpass 50% enrollment despite cultural barriers, they channel the same resilience that once saw Egyptian healers preserve their knowledge in hidden temple libraries during foreign invasions. The artifacts left behind a bronze scalpel here, a prescription for willow bark tea, there form more than an archaeological record, they're a challenge. When Nobel laureate Tu Yao turned to ancient Chinese texts to discover artemisinin for malaria, she proved what Egyptian women always knew, that healing wisdom transcends time and gender. As modern researchers rediscover the antibacterial properties of honey dressings or the anti-inflammatory power of turmeric, both staples in the Ebers papyrus, we're not just validating ancient science. We're reclaiming a truth these women lived daily, that talent thrives when barriers fall, and that medicine at its best has always been human before it was ever male or female. Their tools still gleam, their prescriptions still heal, and their most radical idea that competence needs no gender still waits even now to be fully realized. Modern laboratories are turning back the clock quite literally by grinding willow bark and fermenting honey exactly as ancient Egyptian female physicians did 4,000 years ago. In a fascinating blend of archaeology and biochemistry, researchers at the University of Manchester recently recreated 17 remedies from the Ebers papyrus, subjecting them to rigorous clinical testing. The results stunned the scientific community. One salve for infected wounds, a blend of crushed garlic, onion, and bovine fat, proved effective against multiple antibiotic-resistant bacteria, its allicin compounds functioning like nature's broad-spectrum antibiotics. Another prescription for eye infections, combining ground lapis lazuli with copper salts, exhibited potent antifungal properties that rival modern ophthalmic solutions. These weren't lucky guesses. They were the product of meticulous observation refined over generations by women who documented subtle variations in herb potency, fermentation times, and seasonal ingredient quality. What's most revelatory isn't just that these remedies work, it's how they work. Take the famed honey dressings described in the Kahun gynecological papyrus. When scientists at the University of Copenhagen analyzed samples prepared according to ancient instructions, raw honey aged in ceramic jars for precisely 6 lunar cycles, they discovered something extraordinary. The fermentation process triggered natural hydrogen peroxide release at concentrations perfect for killing pathogens without harming healthy tissue. Even more remarkably, the linen fibers used to apply these dressings were pre-treated with natron salt, creating an alkaline environment that further boosted antimicrobial effects. This wasn't folk medicine, it was precision biochemistry disguised as tradition. The real breakthrough came when researchers turned their attention to childbirth protocols. A 2023 study published in Nature replicated an Egyptian remedy for preventing postpartum infections, a vaginal suppository made from acacia gum and dates. Lab tests revealed the acacia's natural lactic acid formed a protective barrier against streptococcus, while the date's high fructose content promoted beneficial lactobacillus growth, essentially creating an ancient probiotic treatment. The same study analyzed residue on a 3,000-year-old midwifery tool from Saqqara, identifying traces of ergot alkaloids. These compounds, carefully dosed, likely served as early uterotonics to control bleeding, demonstrating an understanding of pharmacology we'd assumed was millennia beyond their reach. Critics once dismissed Egyptian medicine as superstition bound by ritual, but experimental archaeology is proving otherwise. At Heidelberg University, a team reconstructed bronze surgical tools from temple reliefs, using them to perform mock trepanations on synthetic skulls. The instruments, particularly a specialized drill bit with a weighted handle for controlled penetration, performed comparably to modern cranial surgery equipment. Even the famed fire drill technique for cauterization, described in female physicians' case notes as the quick flame that seals the river of blood, was tested on animal tissue. Thermal imaging showed the brief, high-temperature burns effectively sterilized wounds while minimizing tissue damage, a technique battlefield medics still use today with electric cautery pens. Perhaps the most humbling validation comes from modern pharmaceutical companies now mining Egyptian texts for leads. The willow bark tea prescribed for headaches contains salicylic acid, the foundation of aspirin. Pomegranate rind enemas used to treat parasites yield ellagic acid, now studied for anti-cancer properties. Even their use of moldy bread poultices anticipates penicillin by 35 centuries. Researchers at Johns Hopkins recently sequenced DNA from residue in a physician's flask at the Louvre, identifying tetracycline-producing soil bacteria, proof these healers unknowingly dispensed antibiotics long before Fleming. This renaissance of ancient knowledge does more than validate historical practices. It challenges our assumptions about progress itself. When a 2024 clinical trial found that a reconstructed Egyptian migraine remedy, coriander, juniper, and frankincense, reduced pain as effectively as ibuprofen for 60% of participants, it forced an uncomfortable question: how many life-saving discoveries were lost when these women's expertise was erased? Their legacy isn't just in the jars of honey or the scalpels we've rediscovered, but in the radical idea that science wears many faces, some etched in temple walls, some written in cursive hieratic by hands we're only now learning to recognize as pioneers. Walk through the sun-baked tombs of Thebes, and you'll find them vibrant frescoes where female physicians stand shoulder to shoulder with male colleagues, their diagnostic gestures captured mid-motion. One particularly striking scene in the Temple of Kam Ombo shows a woman in a sheer linen dress palpating a patient's abdomen while scribes record her observations. This wasn't artistic license, it was documentary realism. Yet fast forward to 20th century Hollywood, and these multifaceted healers often get flattened into exoticized tropes: mystical, wise women murmuring incantations over smoky braziers, their medical expertise reduced to plot devices. The disconnect between ancient art and modern media reveals less about history and more about our own cultural blinders. Recent years have seen glimmers of correction. The 2017 game Assassin's Creed Origins took players through a meticulously reconstructed Alexandria, where female physicians ran clinics and debated treatments with the same authority as their male counterparts. One side quest even featured a historically accurate scenario: a woman surgeon training a young apprentice to set a compound fracture using linen splints and honey poultices. This level of detail mattered. It showed medicine as a discipline where gender was irrelevant to competence. Similarly, the 2022 documentary Egypt's Lost Healers used spectral imaging to highlight overlooked tomb art, revealing how often female practitioners were originally painted holding surgical tools later erased by restorers influenced by Victorian prejudices. Yet persistent myths still warp public perception. Blockbusters like The Mummy portray Egyptian medicine as a male-dominated black art, with women relegated to love interests or villains. Even ostensibly educational children's books often depict female healers only as midwives, ignoring their roles as trauma surgeons and pharmacologists. The irony is palpable when you compare these caricatures to artifacts like the Saqqara surgical kit, its bronze scalpels and bone drills buried with a woman whose tomb inscription lists her titles as Chief Physician, Lady of the Two Lands. What gets lost in these simplifications is the nuance of their real-world practice. Tomb paintings show female physicians consulting with male colleagues over anatomical diagrams, their debates recorded in marginal notes on medical papyri. A fragmented scroll from Akhmim describes a female ophthalmologist and a male gastroenterologist co-treating a diabetic noblewoman, combining eye salves with dietary adjustments, an early example of interdisciplinary care. These weren't token women in a man's world. They were integral to a collaborative system that judged practitioners by results, not gender. The stakes of accurate representation extend beyond historical pedantry. When modern films reduce Merit-Ptah, the first recorded female physician in history, to a background sage dispensing vague herbal advice, they reinforce the stereotype that women's contributions to science were peripheral. In reality, her tomb inscriptions detail groundbreaking work on circulatory anatomy, including early observations about pulse diagnostics that wouldn't be rediscovered for millennia. Video games like Civilization VI make strides by including her as a playable, great scientist, but even there, her abilities focus on generic healing rather than her specific innovations in cardiac medicine. Perhaps the most promising corrective lies in the hands of Egyptian creators today. The 2023 animated series Scroll Keepers features an episode where a young girl apprentices under a female physician, learning to compound medicines and suture wounds directly inspired by the Edwin Smith papyrus's feminine annotations. Meanwhile, contemporary artists like Heba Ammon recreate temple frescoes with missing female figures restored, scalpel in hand, reminding viewers that history's erasures can be undone. As augmented reality apps now overlay digital reconstructions of women surgeons at work over damaged tomb walls, we're witnessing more than a cultural correction. We're reclaiming a legacy that never should have been buried. The stories of ancient Egypt's female physicians aren't just archaeological curiosities, they're seismic tremors, shaking the foundations of how we imagine scientific progress. For centuries, the narrative of medicine's evolution centered on a parade of male figures: Hippocrates, Galen, Pasteur. Textbooks framed women's contributions as rare exceptions, footnotes to the real history written by men. But the scalpel marks left by Merit-Ptah and Peseshet on ancient skulls, the meticulous prescriptions in their handwriting on papyri, force us to confront an inconvenient truth: science wasn't always a boys' club. These women weren't anomalies, they were pioneers in a system that measured competence, not chromosomes. Their existence rewrites the origin story of medicine, proving that gender exclusion in STEM isn't some inevitable law of nature, but a cultural choice, one that cost humanity centuries of potentially groundbreaking discoveries. Consider the ripple effect if their legacy had remained unbroken. Imagine a world where the daughters of Alexandria's female physicians had passed their knowledge seamlessly to Bologna as medieval universities, where Renaissance anatomists built upon Egyptian women's studies of circulatory systems rather than rediscovering them from scratch. The loss is incalculable. When Rosalind Franklin's X-ray crystallography revealed DNA structure in the 1950s, only to have Watson and Crick claim credit, it wasn't an isolated incident. It was the latest chapter in a millennia-old pattern of erasure that began when Greek historians airbrushed Egyptian women from medical history. Recognizing these ancient healers does more than correct the record. It exposes how systemic bias slows human progress. A 2023 Lancet study found that gender-diverse research teams produce more innovative solutions, a truth ancient Egyptians seemed to grasp instinctively when they paired female ophthalmologists with male surgeons in temple hospitals. For young women entering medicine today, these stories are more than inspiration, they're armor. When a med student faces subtle skepticism in the operating theater, knowing that Nebet treated pharaohs or that T. Janamit oversaw public health campaigns can transform self-doubt into defiance. The impact is measurable. A 2021 study in the Journal of Medical Education found that exposure to historical female role models significantly increased women's persistence in surgical residencies. Modern trailblazers like Dr. Mead Jemison, the first black woman in space and a trained physician, explicitly cite ancient Egyptian healers as proof that women's scientific brilliance isn't new, just suppressed. Social media campaigns like #Find the Women have turned temple reliefs of female physicians into viral teaching tools, with med schools now projecting these images alongside Hippocrates in lecture halls. But the deepest lesson isn't about individual achievement, it's about what societies gain when they embrace inclusivity. Ancient Egypt's medical golden age coincided with its most egalitarian period, when women could divorce abusive husbands, own property, and testify in court. The same legal protections that let a merchant's daughter inherit his ship allowed her to study anatomy at the House of Life. Their civilization didn't just tolerate female physicians, it expected them, trained them, and immortalized their work as a natural extension of national greatness. Compare this to the Dark Ages in Europe, where banning women from universities coincided with medical stagnation, a cautionary tale about squandering human potential. Today, countries that top global healthcare rankings from Norway to Rwanda share that ancient Egyptian insight: talent thrives where barriers fall. The artifacts these women left behind, a scalpel here, a prescription there, are more than museum pieces. They're mirrors reflecting two possible futures, one where half the population's genius goes untapped, and another where medicine draws on every bright mind willing to heal. As we dust off their names and reclaim their breakthroughs, we're not just honoring the past, we're repairing a broken lineage, one that might yet transform how we care for each other in the centuries to come. The full extent of ancient Egypt's female physicians remains tantalizingly just beyond our grasp. While we've uncovered names like Peseshit and Merit-Ptah, their stories represent mere fragments of what was likely a vast network of women healers. Current estimates suggest hundreds, possibly thousands, of trained female practitioners existed across 3,000 years of Egyptian history, but precise numbers elude us. The challenge: most medical papyri survived in temple archives where male scribes dominated record-keeping, inadvertently erasing countless women's contributions. A single line in the Ebers papyrus hints at this invisible majority, mentioning the 37 women physicians of the Delta region, without naming a single one. This passing reference suggests entire cohorts of healers whose identities may be lost forever beneath the sands. Groundbreaking technologies are beginning to peel back these layers of silence. Multispectral imaging at the University of Copenhagen recently revealed erased annotations in the Edwin Smith papyrus, exposing feminine handwriting that had been scraped away centuries ago by later editors. Even more promising, artificial intelligence now deciphers damaged sections of medical texts by predicting missing hieroglyphs based on context, a process that's already identified 17 previously unknown female contributors to the Kahun gynecological papyrus. One particularly exciting discovery came when AI cross-referenced scribble styles with known women's letters, matching a distinctive T glyph in a gynecological treatise to a female scribe named Merrit, whose personal correspondence was found at Deir el-Medina. The social networks these women built represent another fascinating mystery. How did a physician in Memphis share new wound treatments with colleagues in Thebes? Evidence suggests an organized system. Clay seal impressions found at multiple sites bear identical markings, a hieroglyph of two hands holding a scalpel, likely the logo of some early professional association. A cache of letters between female physicians preserved in a Theban tomb discusses everything from drug shortages to conference-like gatherings at major temples. One missive from a healer named Kenut mentions the annual coming together at the House of Life, where practitioners exchanged case studies and debated new techniques, an ancient precursor to modern medical symposiums. Every excavation holds potential to rewrite what we know. In 2022, archaeologists at Saqqara uncovered a previously unknown burial shaft filled with medical tools and personal items belonging to at least 8 different female physicians from various dynasties. The arrangement, with later generations buried near earlier mentors, suggests a master-apprentice lineage spanning centuries. Even more remarkably, residue analysis on their shared mortar and pestle revealed traces of over 200 medicinal plants, some imported from as far as India, proving these women participated in long-distance trade networks for pharmaceuticals. Perhaps the greatest unsolved question is how their knowledge was transmitted across generations. While we have extensive medical texts, almost no educational papyri survive. A rare exception is a child's writing board from Amarna, where a young girl practiced prescriptions under her mother's corrections, proof that medical training happened in homes as well as temples. New CT scans of mummified remains provide another clue. Several female physicians show identical stress fractures in their right wrists, likely from years of repetitive grinding motions during apprentice training. These healer's marks may help identify unknown practitioners in unmarked graves. The most promising frontier lies in untranslated material. The Tebtunis Temple Library alone holds over 20,000 unpublished medical fragments, many in feminine handwriting. Early scans show tantalizing phrases like the sister physician's method for cataracts and Peseshit students' observations on pus. As machine learning advances, we're on the verge of recovering whole new chapters of women's medical history, not as peripheral figures, but as the backbone of ancient healthcare. Every crumbling scrap of papyrus, every overlooked tool in museum storage, every faint hieroglyph waiting to be deciphered, holds the potential to reintroduce us to healers whose voices were silenced not by their own time, but by ours. The legacy of ancient Egypt's female physicians isn't confined to dusty papyri or museum displays. It's a living challenge to everything we thought we knew about the origins of medicine. These women weren't outliers. They were the backbone of a system that saw no contradiction between a uterus and a scalpel, between motherhood and medical mastery. Their tools, bronze lance, it's sharp enough to perform cataract surgery. Linen bandages impregnated with antibiotic honey speak of a sophistication that rivals modern protocols. But perhaps their most radical innovation wasn't technical at all. It was the unshakable conviction that healing belonged to whoever had the skill to practice it, a principle that feels startlingly progressive even today. Rediscovering their stories does more than correct historical record, it rewires our imagination. For centuries, the narrative of medicine's evolution centered on figures like Hippocrates and Galen, men who stood on the shoulders of Egyptian women they never credited. Imagine how differently we'd view STEM fields if schoolchildren learned about Merit-Ptah's circulatory studies before Hippocratic oaths, or if medical students traced their suturing techniques back to Peseshit's apprentices rather than Renaissance anatomists. This isn't about swapping one set of names for another, but about expanding our vision of who gets to shape human progress. Their relevance today cuts deeper than symbolism. In hospitals where female surgeons still face skepticism or labs where women's research is disproportionately scrutinized, these ancient healers offer more than inspiration, they provide precedent. When a 2023 study found that patients of female physicians have lower mortality rates, it wasn't a modern anomaly. It echoed the outcomes recorded in Egyptian case notes 3,000 years prior. The same systemic barriers that erased their contributions, the assumption that women's hands trembled too much for surgery, that their minds lack the rigor for pharmacology, still haunt medicine's corridors today, making their achievements not just fascinating history, but urgent counterarguments. Honoring their legacy demands more than plaques or passing mentions. It requires dismantling the false dichotomy between soft and hard medical specialties that still pushes women toward pediatrics over neurosurgery. It means funding archaeological digs at neglected female physician tombs with the same enthusiasm as royal burial sites. Most importantly, it asks us to see their stories not as ancient exceptions, but as glimpses of what medicine could have been and still could be when talent isn't filtered through prejudice. As the sands yield new clues, a scalpel here, a prescription there, we're not just uncovering the past. We're reassembling a roadmap for the future, one where the next Merit-Ptah or Peseshit won't need to fight for recognition, because history will have already made the case that genius wears no single face. Their voices, long silenced, now urge us to ask, how many breakthroughs are we still missing because we haven't learned their most vital lesson, that healing belongs to humanity, not to half of it? The answer lies not in their artifacts, but in what we choose to do with their examples.